Hello everyone, I'm Dr. Sandya, Senior Pediatric Consultant from KIMS Cuddles, Secunderabad. Today I'm going to discuss the most important topic, the importance of hydration in children. Before we move on, I would like to say why water is important. Water intake is important for a daily function of two-thirds of our body consists of water. This water is not just a part of small cells, but part of tissues, organs. It is needed for digestion, transport of nutrients to maintain the optimal functioning of our body. And when it comes to children, they're not just smaller adults, but they are unique. There are some differences in children that makes them more prone for dehydration. Like they have a higher basal metabolic rate. That is, for a given physical activity, they tend to produce more amount of heat. So because of which they have lots of sweating, and that leads to dehydration. The sweat not only contains water but also salts, electrolytes. So sweating also increases evaporative losses. So all these factors leads to dehydration, and they have a higher body surface area to body mass. That is, their body is exposed to most of their body is exposed, which absorbs heat rays, and it makes them more prone for overheating. They have immature thermoregulatory mechanism. Their brain is not that developed, so they do not identify the thirst. Like suppose if we are getting dehydrated, we get more thirsty, we try to drink more water. But when it comes to children, they do not identify these thirsty cues, and they have a limited fluid resource. Their weight is less, so amount of fluid in their body is also less. So even few episodes of vomitings or one or two episodes of loose stools are enough to set the imbalance. When it comes to water balance, it is a delicate process. Any disturbance either in the water intake or increased losses will disturb the balance, leading them to dehydration. Okay, so the usual water losses would be in form of either urine, stools, or sweat. And when it comes to children, they are always dependent on adults uh, for providing them with water. When we get thirsty, we go and drink. But when it comes to small toddler, like they are not able to reach water or decide that thirst. So it is always the duty of the primary caregiver or the mother to provide them with water. Okay, how to identify dehydration in children? Okay, I'm going to tell you how to identify dehydration in children. Uh, First, keep a tab on their activity. When the dehydration sets in, the child who is previously active, calm, they try to get cranky, fussy. They might be irritable, and as the dehydration worsens, like their activity gets more and more affected, they may get more tired, lethargic, or they may even be drowsy. And urine output is an important indicator how you can monitor the hydration status of this baby. uh, the number of wet nappies will give a clear idea about the child's, smaller baby's hydration status. If you feel ki your baby is not passing adequate urine, then that's a worrisome. And the other indicator is urine color. The normal color of urine in most of the children is light yellow to clear. When there is a dehydration or any loss of fluid, urine gets more and more concentrated. So the color of the urine changes from pale yellow to dark concentrated urine, dark amber colored urine. Okay, and the other things you can say is like their eyes appear more prominent, sunken. Eyes are not that moist. Their mouth, it would be dry, tongue is dry, and when they cry, you feel ki the tear production is less. Overall, to say, it is the activity of the child and the urine output that gives you a better indicator. If you feel your child is getting more and more drowsy and has little or no urine output, it is definitely worrisome thing. You have to come to the hospital those times. Okay, the next question is, my child is having vomiting and loose stools, how to rehydrate him? Like I said, water balance is delicate. When it comes to a child with vomitics and loose stools, it's just not the water that is lost. There might be electrolyte losses also. So, giving plain water is not going to help in these situations. We have ORS or electrol sachets. We can dilute them accordingly. Now, there are lots of formulations, but when it comes to sachets, there are only two things that are available, either 200 ml sachet or a 1 liter sachet. Dilute it accordingly. If you take a bigger sachet, dilute it in 1 liter of water. And once diluted, you can use it for 24 hours. Keep on giving the child sips of ORS. If you try to forcibly feed them for like bigger gulps and all that, they might vomit. So try to feed a small quantity, sips in between, and then keep on giving. Some people, what they do is they take 1 or 2 spoons of ORS, dilute in some amount of water. That will not be accurate because the electrolyte distribution might not be, I mean, electrolytes and salt distribution might not be equal when you do this. And giving plain water or glucon-D or fruit juices might not help these situations. And apart from ORS, you can consider giving home available fluids like buttermilk, a glass of water with pinch of salt and a spoon of sugar, or coconut water. Okay, but ORS would be ideal one to replenish. Okay, and then what advice would you suggest on keeping my child hydrated in summer? Okay. This is a tricky one. Huh? So, forcing a child to drink water is almost impossible. Most of the children are picky eaters. They do not drink water on a regular basis. So, coming to summer, forcing them would be difficult. So, what we can do is we can give sips of water. When it comes to children, they always mimic their parents. We should be the ideal role model for them. When we have proper habits, they tend to copy our habits and then inculcate good things. Always keep water within the reach of child. You can, when it comes to smaller kids, toddlers, you can consider giving colorful bottles or cups with their favorite cartoon characters or something funky so that they keep on drinking. If your child does not like any like plain water, like taking plain water, you can consider adding a natural uh, what do you call natural colors. You can consider adding a few leaves of mint or a piece of cucumber or pinch of lime juice to make it flavored. I would say it would be better to avoid carbonated drinks and packed beverages. When it comes to packed fruit juices, they do contain water, but apart from that, they do contain lots of sugar, and it's not ideal. And when it comes to sparkling water or soda, I mean, if it is a bigger kid, once in a while is okay, but I would not suggest. Instead of this, you can consider a variety of fluids that are easily available, like buttermilk, lassi, or diluted fruit juices with little or no sugar. And let's go to the next question. What are the best foods to eat for staying hydrated? Uh, you can consider giving plenty of fruits like watermelon with a high fluid content or vegetables or something like kheera, cucumber, so that they also enjoy eating. Okay, what tips would you suggest? Okay, so like I said, forcing the child to drink water is difficult. Uh, Encourage the child to take sips of water in between. And whenever you are planning to go outside, always carry their water bottle with them and remind them to take sips of water in between. And you can use coconut water or lime juice or buttermilk also in between. And when it comes to elder kids, adolescents, they engage in more of physical activity. Like summer is the only time where they get some time to go and play out. But at the same time, you have to insist key they have to take a in between breaks to take a water or sips of water. And hydration during this physical activity is more important. When it comes to strenuous activity or increased physical activity, they tend to overwork. Okay, and children do not know their limit. They keep on playing. They don't even take breaks. So because of which they tend to sweat a lot and they get more and more dehydrated. Especially if they have poor hydration status prior this activity, they are more prone for overheating and dehydration. So before the child goes for any strenuous activity or physical activity, you try to remind them that they should be taking food. They should be taking adequate water. Encourage them to take fluids 2 to 3 hours before they go for their play and all that. And even during the play, it should be in shady areas or cool areas rather than playing in a dry, hot summer. Okay, and give them small, frequent breaks so that they can keep drinking water. And when it comes to fluid of choice during these strenuous activities or physical activities, water would be the ideal one. But depending on the activity and the age of the child, you can consider energy drinks. Once in a while, energy drink is okay, but ideally it should be water. And can you suggest any tips to encourage children to drink more water? Okay, remind them to keep on drinking water, and you also should be a role model, encouraging them to drink. Any more questions? Okay. If there are no questions, I'd like to conclude the session with few things. Summer, we should take proper care. Stress on the hydration. This mantra is more important. Okay. Give plenty of liquids. Avoid packed sweet juices. Okay. And then keep a tab on their activity and urine output. Plain water is not going to suffice stool losses in diarrhea. Okay. Thank you.